What's really going on, everyone? Back again with another episode. Once again, please be sure to check out. We had an amazing guest last episode. We had Mayor Brandon Scott from Baltimore. And this time, we are back with yet another guest. But before we get into all about our latest guest, be sure to follow us wherever you get your social media, TikTok, X, and Instagram at WRGO Pod. Be sure to like, listen, and subscribe on all of our platforms, including wherever you listen to podcasts, including on YouTube, where you can see all four of our smiling faces together. Now, once again, I said that we continue to level up and we have yet another amazing guest. We have the distinct honor and pleasure of being joined by Dr. Krystal Redman, rooted in their political lineage of grassroots and organizing and activism towards Black and queer liberation and health freedom in the heart of Los Angeles. Dr. Redman centers their work in health liberation, freedom, justice, with a priority of liberation for folks who reside deep within the margins and in reproductive justice. Dr. Redman is a self-published author and a speaker throughout sexual and reproductive justice, health movements, as well as in the public sector. They bring years of experience in combating nonprofit and healthcare industrial complexes and leading, designing, implementing justice and health equity initiatives, as well as uplifting the intersections of racial justice and systematic oppressions rooted in anti-Blackness, so white supremacy and capitalism and its connection to adversing Black and Brown communities. Now, as you can see, folks, her bio is extensive, well beyond what we could put together for our own. So, Dr. Redmond, thank you very much for joining us. How are you today?
I'm doing wonderful. Thank you for having me. And yes, that bio is a lot. I gotta figure out how
Detailed.
to cut that down.
No, I think when you have done as much as you have done, I think certainly it is deserved and earned to be read in full. So, Dr. Redmond, before we, kind of level set to some more kind of more serious health conversations, I think what we wanted to know, as you can imagine, most people know what a doctor of medicine is in terms of, our primary care physician and things like that. Can you explain for our audience what you have, which is actually a doctorate in public health? And what that actually focuses on. I think a lot of people would actually be curious to know exactly what it is that you studied and what you do.
Yeah, I'm actually pretty excited to answer this question because I get it quite a bit of times. And it excites me because while public health has been around for dozens and dozens and dozens of years, I think not until maybe the last 5 to 10 years has been to where communities and broader audiences have been interested in finding out what is public health? How is it applied? How is it compared to different levels of healthcare and advanced degrees? So it gives me a lot of privilege to and honor to really kind of like dissect what that means. And so essentially, as you stated, there's doctors of medicines and different levels of, doctoral degrees and such. But the Doctor of Public Health, or a DRPH rather, is an advanced practical or practitioner's degree, but it focuses on leadership, system change, and applied public health. So applying principles into practice, essentially. So while a MD focuses on diagnosing and treating individual patients, a DRPH works at a population or communal level. And we really look at designing policies, transforming institutions, addressing systemic inequities and structures, and really building out community-driven solutions. So, in many ways, a DRPH is trained to see the whole ecosystem. So, the political forces, the social conditions, community wisdom, and the health outcomes that emerge as a result. And so my work really sits at the intersection of community organizing, policy shaping, health equity, and ensuring that communities who are most marginalized or who have the furthest proximities to power are centered in those solutions. So those are kind of some of the main components of the DRPH degree, and I can, dive deeper if anyone's interested.
Yeah, and I think it's so interesting to hear that, Dr. Redmond, because I think one thing that often gets lost, I think, in actually like changing like health policy is someone actually has to design the policy and assess kind of what is actually happening. Did you specifically have a moment where you said, "Hey, actually, I don't want to be the person who is diagnosing you. I want to build the structure around to actually implement better health outcomes on a larger level." Did you have one specific moment where you said, "Actually, you know what, health advocacy," and with that focus on that word advocacy, did you have a moment where that specifically was something where you said, you know what, this is actually my calling?
I have many moments, and as I look back, and I've been in public health work my whole life without even having the title of what it actually was. Similar social justice work. I've been a part of social justice and movement work since birth, but just never really had a name for exactly what those intersections were, and kind of rooted in my lived experience. But I will name two distinct moments. So. I think one of the biggest moments is I'm from Los Angeles, California, specifically Crenshaw, and grew up in a time where the Black Panther movement kind of moved into different institutions. And what I'll name here is like my family being some of the founders and creators of one of the largest gangs in LA, the 90 Crips. And from there, Black members of Black Panthers kind of moved into these kind of formalized structures, but they were built essentially to combat the largest gang at the time, which was the LAPD, and built to cover and protect the Black family, but also, in addition to protection and safety, to build out mutual aid support, to really think about what were some of the gaps within the community, and how could we, as a community, kind of fill those gaps. So that political lineage gave me kind of a stepping stone into viewing the world through a different lens or multiple lenses, right? So as I navigated my experiences in LA, and also, being someone who was under resourced and going through school, not just because I value like credentials or letters behind your name. Like that wasn't the idea at all. It was a way of survival, how you have housing, how you get food, some of those resources. So using that privilege as a way to kind of move through was vital. And then so during that lived experience, there also came a lot of advocacy work with that. If I'm under resourced and unhoused, but I have that privilege in going to school and receiving some of these resources, how do I also like uplift this within my community of like, hey, there's still this deeper rooted issue here. There's still barriers to accessibility, and for folks that fall deeper within those lines of margin, right? So throughout kind of my lived experience in advocating for my communities and communities that were deeply marginalized, even beyond my identities, was some of the stepping stones that, woke me up to this idea of like how you deepen your advocacy, even in care. But the other thing I will name is outside of like my political lineage is I was pre-med. I went to school and I'm like, yes, I want to be a doctor because without naming my age here, I grew up also in a time where it was like in order to get out the hood, and being very clear, Crenshaw was the hood at the time. Now it's deeply gentrified. So I don't know what it is, but you had to be a doctor or a lawyer. Those were our options, or go into the military. Like that's what we knew, and predominantly because so many people in our family didn't have access to formal education in that type of way, or college or what have you. So all we knew is what we kind of saw a little bit, so I said, all right, well, I'll be a doctor because, I really am invested in care and in healthcare, in our health outcomes, in our like progress or our journey towards liberation and freedom, and what that looks like when we live healthy, liberated lives, and we have the things that we need. So, and while I didn't have the language back then, like these are some of the thoughts, right? So, in my academic journey, I also, worked in direct care. I was a CNA, and a birth clerk, and worked at community centers while I was, going to school for pre-med. And prior to applying for medical school, I paused and I did a master's in health administration because at the time I thought, yes, I want to be this doctor. And I changed different specialties. I was like, I want to be an OBGYN. And then some really messed up things happened to people that I knew around like cardiological health. I was like, I want to be a cardiologist. Like I changed, right? Because I'm like, how can I truly like be the best support for my communities? And where are the gaps in our healthcare, right? So I was still trying to figure it out. I minored in women's studies and gender studies and sociology at the time because I'm like, there's something else missing there. What is this component, this gap between direct care and the quality of that care and our health outcomes. And when I say our, specifically Black folks,
Mm.
Black queer folks, Black disabled folks, Black elderly, et cetera, right? So I'm like, what is this thing? So I paused, did a master's in health administration with a focus on policy planning and development. And while I was there, I'm like, wow, there's so much more. There are these structures that couple with healthcare. And then so kind of going through that degree program, I'm like, but that still isn't it. You can put
Right.
policies in
Yeah.
place. You can like work within a system to create the most like, I don't know, the strongest infrastructure within that particular system, but there's a larger scale issue, right? These are still micro level issues. So what was the thing that was missing? And along that journey, I learned about public health. And public health to me essentially was a way that you can center advocacy and you can center organizing and how you not only set policies, but essentially who are creating those policies to put different structures in place that truly center those within the furthest proximities to power.
I'm like kind of glad you touched on both of those memories, at least for me, because I went through that same stage of attempting to figure out, what exactly I wanted to do. And then it's kind of amazing to see how you have direct political connections to the Black Panthers, and civic engagement and advocacy was something they were like heavily big on. And that's one of the reasons I joined my fraternity. So with your organization, Sage, how do you think that like your advocacy work is advancing that mission? And why is it so essential for the marginalized communities, such as Black and Browns, and so on?
Yeah. I think with my privilege, right? Like, I can name many of the privileges I hold, even within my lived experiences and my marginalized identities, but within my privileges of like having a title, having positional title, having letters behind my name, being, able-bodied or someone who doesn't have a physical disability, someone who also is, I have a smaller body frame, being light skinned, like all of these different elements or of my identities put me in positions that can also give you access to levels of privilege, right? So I think in my experience using kind of wherever that privilege is in creating spaces that don't center me, but also creating spaces that again center those who reside deeper within those margins. And I think that I don't think I named this, but I'm an abolitionist. And so I think people think of abolition as like, how do we dismantle, disrupt, and create and dream about structures that truly serve us and to center those that have historically and currently been oppressed. But I also think about it in a way of like, how can we also use that framework and create spaces that, don't necessarily center us, but center those who fall deeper within those margins. And also, as an abolitionist, how do we kind of dismantle and disrupt some of the things that we've been socialized? We're all socialized into white supremacy. And like, how do we kind of dismantle and disrupt how that shows up within us? Even within our identities, right? And within our oppressed identities. So with that being said, because of kind of that positional power and the goal of like creating more spaces that can just like be space where folks can come in and just pull our strategies together, center grassroots efforts, and figure out how we can move public health solutions, right? And so essentially, I created the SAGE Institute, which stands for Strategy, Equity, Justice, and Health Institute, and a think tank within it. So, a part of that institute and what drove me to create that space is that it was designed to be a public health, a health, and a community rooted leadership home for dreamers, to generate research, narratives, strategies that center our lived experiences, which essentially is like qualitative data. And so we don't just like respond to crises, we imagine new systems, new structures, but that are rooted in our joy. Because very often when we speak about our lived experiences, and when others tell our stories and speak about our lived experiences, it's rooted in our trauma. And so a part of kind of like creating really great and strong public health strategies is thinking about what does liberation look like? What is the route of getting there and centering our joy, our rest, and collective justice. So the hope is when you think of public health strategy and community driven action, you think of the SAGE Institute. So essentially, advocacy is healthcare that, well, I will say this. Advocacy is essential because healthcare does not exist in a vacuum, right? And then so policy, culture, power, and resources really determine who receives care and who is denied it. So in marginalized communities, effective advocacy looks like centering community leadership, not institutional authority, challenging harmful policies and building alternative models of care, demystifying health information and making it accessible to folks, and then finally naming oppression out loud, not just kind of silencing it, but like naming it out loud while also uplifting, again, the practices of joy, rest, and resilience within that advocacy work. So it's really about like how we create spaces where our work is used to shift narratives and shift power.
You talked about this earlier, talking about that you got into the public health field just because you wanted to also close racial gaps. And diversity matters in every industry, but I think in public health, especially when I think of like Black maternal health and nutritional things for our people in our communities, was there a moment that you can share with us where you felt like your impact and you being there changed policies or just changed a patient outcome?
Ooh, yes. So prior to come, well, I live in Atlanta now, well, Atlanta, Georgia, but prior to moving to the South, again, and being in California, much of my work was centered in addiction medicine. So, and I was in direct care. So, I oversaw 24 ambulatory care facilities and about 5,500 patients that were all navigating addiction, emotional, psychological, and physical dependency of opiates. And you see a diverse level of experiences and what kind of brought them to that point in their in their lives. So in that unique position, being able to be with patients, and even if it was just like listening to their lived experiences, meeting I cringe at the term like meeting people where they're at, but it's real. Like, especially in care, you can meet people where they're at by offering culturally humble and culturally competent care, that's rooted in that element of liberation. So in some of the experiences I had, just meeting with patients, making sure they were heard, which is huge. Like, I don't want to just step over like making sure folks were heard, but like, what do you also do with the things that you hear? If the patient is requesting a specific test that the, MD is not offering, and, the reasons why that provider is not offering it is rooted in like, really racist science, how like just being that patient advocate. And, at the time, again, in that position, I was the COO for the 24 ambulatory care facilities. So having that positional power where I can call in providers and say, no, this patient needs these tests. And if these tests aren't ordered, that's fine because I'll put them into our standard operating procedures as a part of the test that will be ordered for moving forward. Like having that positional power and making sure that folks got exactly what they needed, were some of my experiences. But outside of just like in the clinical setting, I want to take the opportunity to name some of the other, experiences in the fact that I'm an adjunct professor at Emory in their Rollins School of Public Health. And what has been eye-opening to me is that many of my students, former students, current students will come to me and will name, and this is in our Masters of Public Health program. So these are students that have already done their undergraduate degree or in their master's program and thinking about an even more advanced degree, be it they go to medical school or pursue their DRPH or some other advanced degree. And so many of my students who are Black, who are Brown, will come to me and say, your class was the first class in my entire public health journey where I actually heard heard terms like anti-Blackness and how it relates to public health, racism, systemic injustices, systemic oppression or just oppression at large, or speaking about weathering, the effects of weathering on Black folks and marginalized folks and what that does to our long-term health outcomes. So the fact that, one, I'm just one of a few Black professors there, but also that this is the first time folks are actually getting the language behind what is truly going on, the realities of our lived experiences, and how that also shifts how they show up as a public health provider, as a public health professional, and as a practitioner is something that I'll name here as well.
Yeah, and I also am like, we always hear health equity, but can you talk about like what that actually looks like on the ground in a day to day?
Yes, sure. So, health equity, I think, is a term that a lot of public health providers and institutions and even organizations have began using over the last maybe 10 years or so, and have been adopting more health equity strategies into their public health practices, maybe over the last 5 years since COVID, thinking about kind of like what has occurred in our, in our society over the last 5 years. But I'll argue that, and while I'll speak about health equity and what that looks like on the ground, I also argue that we're beyond health equity. We really need to look at health justice and what that truly looks like. Equity is one thing, it's one concept, right? But if we're truly trying to move towards justice, then let's just aim there, right? But essentially, equity, it goes a step further than health equality. Health equality, obviously, I think everyone has seen like a picture of people at a baseball stadium, and there's like this fence, and there are some people outside of the fence, and some folks are like looking over the fence, trying to see what's going on, and different people have different stepping stones or blocks or what have you. And they say that, equality is that everyone gets a block or something. I might be stating it wrong, but like, and equity is like that everyone gets the size block that they need in order to see over the fence. Justice asks, why is there a damn fence to begin with? Like, why do we have a fence? Who's actually in the crowd? Who's on the field? Why are these people? Who are the identities of the people that are told that they have to exist outside of this fence, right? So it begins to ask deeper questions. And then essentially, what are the resources that need to be offered collectively so that we can all thrive, right? While also still centering those who are most marginalized. I'll just like set the stage for that. But with health equity on the ground, what that looks like is making sure folks have some resources, as much resources as possible, right? And that can look like building out mutual aid support within communities, making sure that we have like harm reduction programs. For instance, some of the communities we work with are, sex workers, street sex workers, as well as folks who engage in survival sex work for income, earned income. And we see that as, true and valid employment. So like, how do we also meet folks where they're at in community and provide them with like, reproductive resources, with condoms, internal, external condoms, with lubrication? How can we discuss with them, conversations about PrEP and PEP and give them access to it, right? Not just like, here's information, but also here's information, here are the resources to reduce the barriers to that information. So health equity really looks like grassroots, in my position, right? Grassroots efforts within communities, giving folks the access to the things that they truly need, and how collectively we build those resources together.
And that actually leads me to my next question. Like we saw the overturning of Roe versus Wade, and we've seen the impacts across the country. I live in New York, so I can't imagine what it's like on the ground in a place like Georgia. Can you talk about what you've seen or if you've seen any major changes on the ground in Atlanta and just in your field?
Yes. So I'm going to say this too, with a caveat of this. Uh, that yes, the dismantling of Roe v. Wade was detrimental to healthcare, to financial resources and how they're funneled, to clinics and healthcare institutions that truly provide comprehensive, full range reproductive care. And then essentially detrimental to the folks that seek comprehensive full range reproductive care, including abortion, because abortion is just one service of reproductive care, right? But because of the dismantling of Roe v. Wade, it created barriers to access to, funds for clinics that provide this work, right? And so when you reduce funds, trying to target a particular service, you target the entire scale of services. So, these financial attacks affect not only just this one particular element of work, but ultimately the overhead, right? So that's one thing. But what I'll also name, yes, the dismantling was detrimental. And I'll explain, some of the things that we're seeing here, but also I want to name that Roe v. Wade was not did not give everyone full comprehensive access to care, right? It wasn't Roe v. Wade, while it allowed increased access to folks. I want us to think about folks who fall deeper within those lines, folks that are underinsured, uninsured, have a Medicare gap, gaps of insurance, right? And folks that live in southern states that also had other state legislature that prohibited access to abortion beyond a certain gestational period, right? So, with that being said, those communities, again, those who, Black, Brown, Indigenous, undocumented, et cetera, have always had to figure out how to get the things that we need and the resources that we need. And community has always created ways of getting the things that we need. And so I'll leave that there. Although Roe v. Wade was disbanded, community has always taken care of each other. So there's that, right? The other thing that I'll name is that since the overturning of Roe, the South has become the epicenter of reproductive health restrictions. So I've seen people traveling hours across different state lines just for basic care, right? And to be clear, abortion care is basic care, so I think that media and messaging tries to pivot this in a way where it's very harmful in messaging around the depth of care when it is basic health care. So I've also seen increased fear, not just with patients and people in community, but providers about offering reproductive services. If you're threatening providers that their medical license will be taken, then folks are scared to practice, right? And essentially are navigating in despite of the oath they took, right? So like you have the state and the government saying what you can and can't do when your role and the main reason essentially that you went into care is to provide care, right? So we've seen several different cases here where patients come to a hospital, a clinic seeking care, and at times emergency care, and the provider is unable to act without having an ethics committee make a decision, or their attorneys pause and figure out if they can provide that care. And then so I'll also name that we've seen a heighten the criminalization of pregnancy outcomes. Folks who unfortunately experience a miscarriage and go to the hospital have been criminally charged with seeking or for some reason having an abortion, as if this was a part of their control, the physical and personal control. So, and these kind of efforts have disproportionately targeted Black folks, Black birthing folks, Black pregnant folks. And then the last thing I'll say is that this affects also medical training, how we train physicians and practitioners currently, because, as we know, the government has threatened funding for institutions and colleges if messaging isn't shifted, right? If our educational models and curricula aren't shifted and such, and our literature. So we're seeing those threats, and it worries me about this next iteration of providers who are coming up under this administration.
You hit, excuse me, you hit on so many, right, Noah, you hit on so many things, Dr. Redman, that we've talked about on previous episodes, and you've mentioned multiple times throughout this episode: accessibility, community, media, and how that is messaging. And then I'm glad you, on the last question, focused about somewhat of a difference of how it is in the South versus maybe Northeast or out West, because of legislation. And considering so much information comes from this administration, especially through major media, like publications essentially. Um, how do you think TikTok and social media, as someone who uses a platform as such, to kind of, advocate and spread true information, how does someone as yourself you see that as a platform? How do you think it affects us as marginalized communities?
Yeah, so I think that, while I don't consider myself any form of content creator by far, there's so many great people out there that do, that have platforms that have broader reach. But I also believe that even if the reach is 100 people, 200 people, your local community or what have you, creating a platform, a social media platform, a live stream, or whatever it is, allows for that greater accessibility. So, which is quite different than maybe 15 to 20 years ago or so, where folks didn't have access to like information at their fingertips. So, for me, one of the reasons why I decided to like get some form of social media and use it towards my efforts in public health was like, hey, yes, I'm just one person, but I also have a community of folks around me that also do some really great work. And how can we like just name things that exist as legislation comes in, as different, things happen within our political climate, within just our social climate, and, all the things that we're navigating through our public health disasters and crises. It could be a local bio lab fire that happened in Georgia and folks aren't talking about it, but people are displaced and unhoused. And like who are speaking about these things? Who has control of the narrative and the media? Because essentially that's who has power. And so I created, at least I use created my platform and use my platform to really think about who has control of that narrative, right? And it doesn't have to be a conversation where I'm like, hey, these are the top public health priorities that are going on right now every single day. But in like, well, not but, and in addition to that, if that's not being said every single day, I think also it draw like centering joy and like fun and liberation also draws people into as well. So like while my platform centers like I try to center accurate information, really uplifting some of the things that are going on right now. Like, for instance, this shift in what is considered professional degrees and how that affects, folks that desire to actually seek and advance their education and their funding and all of that, right? And so, like, I'll name specific things that are going on, but also, open up a conversation and maybe the next day post something fun, right? Like, how do we make sure to, again, meet folks where they're at? So that way folks can feel connected, that we build relationships, even if it's on a digital way, like in this, virtual world or what have you, like how do we still feel connected in a way that feels like we're family and we can have conversations, we can agree. One thing we ain't going to do is agree to disagree on some major stuff. And now, like, if I say it's racist, period, point blank, full stop, So we can have some principled conversations, like as long as we're in this principled struggle together, and then we can have fun. So I think that that's a part of my platform. But again, like social media and that quick accessibility can also be very harmful in a way that, again, who has the narrative? There's so much misinformation that is out there, and folks, will take a soundbite and be like, this is what it is, and how do we move throughout this? So I think that a part of having this platform and others that are also in public health and healthcare having platforms like this, it helps combat some of that. A lot of it, especially under this current administration. So I think that's some of the goals, just kind of like rebuilding trust, creating those relationships, making sure that folks aren't delaying their care because of some of the wild things that they're hearing over here, just like trying to meet folks again where they're at and building up kind of that pathway to care.
Yeah, I think we can all identify a lot with that because I think that's part of the reason why I think we created this podcast and have the conversations that we have, where I think it's you never know where the conversations that the three of us and now the four of us are having are going to go. I'm sure for some people, you might be the only doctor that they know just off of Instagram, and you're the most trusted person that they know in health. And for a lot of people who listen to us, we might be the only Black people who look like them who are talking about these issues.
Yeah.
And I think it's even that difficulty, I'm sure, for you of like, you never actually know just how far your reach is online because it's a really hard thing to quantify. But for a lot of people, you might be their only source of medical information. For a lot of people, we might be their only source of political information.
Yep.
And I think one thing that we especially wanted to, it's kind of like it's the sad joke of, they don't cover the planes that land. And they also, they don't, when public health is going right, that's not news. That's not, what you have done to combat, a opioid issue from becoming even larger. That's not going to make the LA Times or the local papers. When you look ahead to the next 5, 10 years, especially like you said, off of the back of the most major public health crisis in COVID of our lifetime, of a century, what do you see kind of coming up 5 years, 10 years ahead that we need to be talking about more? That, hey, everyone, we need to be centering on this issue because it's coming. Or are there things that you actually think, hey, maybe this might be coming, but we don't even know what's around the corner? I'd love to get your thoughts on just what the future looks like for you all as you plan policies.
Yeah, I have so many concerns. Like, I'm like, and I know I'm smiling, but I'm really like,
Yeah.
I got, there's so many concerns, but I like, and I also say this, like, as Black folks, we know how to smile through like, the things,
That's been
which
all 2025 for us.
yes, and it's the double-edged sword of how we compartmentalize, like, just trauma. So I'm like, I have so many concerns, but it's concerns because we always figure out how to move through things, how we figure out care for our people and those around us. So, while I do have concerns at large with different public health um, uh, bubbling points and crises, I also am very aware of our ability to strategize and to take care of ourselves and our community. So, but my concerns, I'll start with like climate and environmental injustices. So,
Yeah.
like, especially the impact on Southern and coastal Black communities. I'm thinking not just like forever chemicals and PFAS and all of that. But I'm also thinking about like water quality and just some of the weather conditions that have occurred and how that displaces us. There are areas in the South that are still experiencing flooding. And, when still water sits for significant periods of time, it is not good, right? So just thinking about the levels of epidemics and public health and chronic illnesses that can come out of that, right? I think about how, that Flint still doesn't have access to clean water and we're not talking about it. It's been so many years. And there's like Cancer Alley in Louisiana. Like, there's so many climate and environmental issues that are under the radar, but community grassroots organizations are out moving, mobilizing folks. Like there's entire movements around this. So, some of my concerns is definitely climate, environmental justice. To the question earlier around Roe v. Wade and kind of the effects, political effects, but also in real time effects of communities and people. My other concern is maternal and infant mortality and morbidity. And while it's the especially Black maternal morbidity and mortality rates, and especially in the South, are no secret. Like it's being published, they're used as talking points. There are many grassroots organizations and nonprofits, mega nonprofits, and systems really like working on a community level to shift these efforts essentially, but it is a deeply rooted institutional issue. And so a concern is that we're not getting to the root of that institutional issue. And this is on a local and national level. So that is another concern, a public health concern that I see growing. I also am concerned about the attacks on gender affirming care. There's so many attacks on queer folks, on gender expansive folks, on trans folks, and I want people to understand that when folks that reside deeper within those margins are liberated and free. We're all free. We're all liberated and free. And our policies seem to be siloed, and we're not connecting those dots. So the attacks on gender affirming care do pose a significant issue, not just to trans communities, but to Black community at large. And then I'll name like two more. So outside of that, I would also say our mental health landscape, because the layers of trauma and violence we are living and navigating through, and just barely, are going to have some really long-term effects, right? This is a part of that weathering that I spoke about a little earlier. I didn't go into detail, but the concept of weathering, like this buildup of generational trauma, historical trauma, like all these things that weather internally in our bodies and are exhibited externally with our health outcomes. So I have deep concern around how we are centering our emotional and psychological safety and what that looks like, especially for Black folks having to navigate these layered systems of violence. And then the last thing I'll say is the disinvestment in public health systems. So we're seeing that, again, under this administration, that there's this disinvestment and divestment from public health, science, medicine, literature, institutions, all of this, right? And then so when you disinvest from public health systems, you disinvest from public health strategies and programs and care, and just this emerging of it, the questioning of science, you know, I have a lot of concerns there. So. And I'm sorry. Yes, you should be able, folks in communities, especially folks who have not trusted government for good reason, should question science and data, right? Like should gather information in science and data. But I'm saying at large, the questioning of solid and proven science that keeps us alive and safe and protected and all of that. I'm seeing this increase in that done directly through our government. So that concerns me significantly.
Yeah, I'm going to jump in front of Henry and ask a real quick follow-up. But I think one thing, I love that you just said the aspect of water. I think everything that's happened in Gaza has showcased how water is actually a political resource and what happens when water is actually taken away from people. So I love that you mentioned that because I don't think people understand something that we drink every day as actually a political commodity when weaponized. But one thing that I did that I think we would be remiss if we didn't touch on this. Obviously, we are living in this administration. Um, and can you at least talk about how some of those funding levers being taken away, even if they're put back, it's not just, hey, we lost funding for 2 years, how that is actually maybe a 20-year impact. Can you at least talk about from your view how continuous research and how even a year gap or a 6 month gap can have generational outcomes? 'Cause I don't think people actually understand. Like, it's not just you turn the water off and you turn it back on and it keeps
Mhm.
going.
Yeah.
It's you can turn it off and you might try to turn it back on and it takes time to. Can you at least talk about that? 'Cause I don't think that gets talked about enough.
Yeah, absolutely. So by far, I know we're not going to be able to touch on every single layer
Yeah.
of direct and indirect effects of like this funneling of money and these this on again off again kind of switches of, okay, you get some money, you get some, maybe you don't. uh One, when the money is geared towards public health, research, science, medicine, there are clinical trials, studies, active research projects, and that are being actively conducted, right? And when you pull money, and while folks would like to think that a research project or a clinical trial is funded for 10 plus years, but at times it's not. You have maybe a phase one, where you're funded for 1 year or so X amount of months, and then when you show evidence or you meet those deliverables in that phase, then you may be approved for phase two, right? So when funding stops, centers phase one, or at the start of phase two, the work stops, right? And you may have residual funding, or you may be able to pull from local or state level, but at oftentimes not, right? We saw that with SNAP, that when those benefits stopped, There were some states that were like, we have a reserve, we're able to kind of pour in, but only for a certain percentage, right? And then so when benefits like that stop, people go without, people don't eat, kids don't eat, like et cetera, right? And that's not just for the household, that's for schools and all of these other ways that we funnel resources to our communities and communities, including children, right? So I think that this idea that okay, when we start back up, then the research continues, the clinical trial continues, but no, the infrastructure falls, right? People lose jobs. People aren't working on, like, they're moving on to, hopefully to other elements of employment and such, right? Like, because people have to pay their bills and survive. So it's not a fact of like, okay, now when the administration shifts again, really hoping it will, shifts again, that, okay, this next iteration administration provides us with, let's just dream big, all of the resources we need possible. It's still going to take 10, 20 years for us to create that infrastructure to truly be able to pour into communities, right? And then, so I'll say on a grassroots level, I am the executive director of a nonprofit of a reproductive justice organization in Atlanta, Spark Reproductive Justice Now. And working at Spark and being a part of like this ecosystem of RJ organizations and also repro health organizations, while we're not personally supported by federal or state funding, a lot of other organizations that provide direct communal health, services and healthcare services to, folks in communities do receive that level of funding. So when funding is cut off, not only does this affect the institution, because if you don't got no money, then you can't pay people and you can't keep the lights on and you have to figure out, how do you move things around or shift down programming, but ultimately affects community and community seeks care elsewhere, but there's no elsewhere, right? So I think the effects are long term. And the unfortunate thing is we won't see how long term it is until we begin to kind of turn that corner a bit.
I'm glad you spoke. I'm glad Noah asked that question because my mind was going toward that same direction. And spoke about like infrastructure and how taking funding could kind of like cause a lot of destruction. How do you think listeners and persons in communities, or how do you in your advocacy work, kind of culture motivate people to kind of still do the work of what they can do now, especially with funding being cut and all of this stuff happening to public health and healthcare overall?
Yeah, so I named building out relationships, right? Getting community with folks, right? Build out your actually at Spark we created this zine called Care Network, right? How to build a care network. Build out a care network of folks that you are sharing information, kind of like having a sounding board for some of the things that exist, holding each other, I won't even just say accountable, but like, you know, just being a space where there's information that's being shared, right? And share credible health information within your networks, within your networks. I also say working to like normalize screening and prevention care. Like, so for instance, because there's a lot of misinformation and disinformation that's out there, a lot of folks are surrounded by fear in accessing particular levels of care or preventative care. So, like, as folks are connected and gathering more adequate information, going with each other to like seek care, that's all kind of a part of like relationship building. I also want to say, like, advocating, like making sure that folks are saying something about what's going on, regardless. I think I said, regardless of what your platform is or your reach is or whatever you're doing, it doesn't even have to be on social media. You can literally just like go to a coffee shop and, post up some flyers. I don't know, like create a space where you're like building some form of community and just like, of folks who truly are invested in this path towards liberation and health justice, and like how can we kind of just move together, during this time. And then and the last thing I'll say um, is I'm a fan of mutual aid. So, like, how can we continue to move together, build up collective resources to support folks forever, but like to support folks during maybe a particular crisis. And I think that it would be really beautiful, just, a caveat, if like Black folks, we could just all come together and build out like like a liberatory mutual aid pool where folks like if you need help paying your rent because that's public health, like all right, cool, here's this. Like, and we don't ask for like these trauma stories, like we just trust that folks need what they need and we like build together, but that's a whole other soapbox. But yeah, I would say building out relationships, using your platforms as best as possible to give out information locally. How do you collectively build power? By just like gathering together, maybe, in real time, grassroots, and then finally like building out mutual aid efforts and networks.
Well, Dr. Redman, this has been, I think, a conversation that I think all the three of us, I think, have honestly personally learned a lot during this conversation. I think this was both us interviewing you, but also you teaching us at the same time. But can you tell folks where they can follow you, where can they follow your talk show, where they can follow Sage? Feel free to drop every any event that you have coming up. We have a large listener base in Atlanta, so the floor is yours, Dr. Redman, just to share how folks can continue to connect with you, but the work that you're doing every single day.
Wonderful. Yes. So folks can visit my website, drkrystalredman.com. I hope I'm saying, yep, drkrystalredman.com. Doctor is spelled out, and crystal with the K.com. My Instagram is at Dr. Krystal Redman. It's very straightforward. I keep it very simple. There's no guesswork. Dr. Krystal Redman, it's there. Yay for that. And also, on my website, you can access the Sage Institute. So if you're interested in the Sage Institute, we have a health executive think tank launching at the top of 2026. We just concluded our public health think tank, but we'll launch that again in the fall. No, excuse me, not the fall, in the summer of 2026. So if folks are interested in that. And then our panel TV talk show is accessible on YouTube, just our panel TV, and also Instagram if folks would like to watch season 1 and season 2. We are hoping to begin filming season 3 soon. So, that's going to be really great. And yeah, I think, and then if folks are interested in connecting deeper, then I believe my email is on the website. So drkrystalredman.com.
Well, Dr. Redman, we thank you for everything that you have done for this conversation, but also just for us as people within the healthcare space. We certainly need you. We need your voice. We need your representation. So, and for that, for us to continue having conversations like these, we hope that you will follow us at WRGO Pod on TikTok and Instagram. Be sure to like, listen, subscribe wherever you listen to podcasts, including YouTube, where we have content going on all the time. Thank you.